Video 64, Social Marketing Concepts, Area 6M Chess Sub-Competencies, 6.3.3. Review the learning objectives for this video. Welcome to this video on social marketing concepts. I am excited for you to explore this topic because it brings together so many of the skills you have been building throughout your studies. Social marketing is a discipline that applies commercial marketing principles and techniques to influence voluntary behavior change for social good rather than commercial profit. This concept was first formally introduced by Philip Kotler and Gerald Zaltman in 1971. Now, it is important for you to understand what social marketing is and what it is not, because this distinction comes up on the exam. Social marketing is not simply advertising health messages or creating catchy slogans. It is not the same as social media marketing, although social media can certainly be one tool within a social marketing campaign. And it is not health communication alone, although communication is a component. Social marketing is a comprehensive, strategic framework that treats your target audience like consumers. Just as a commercial company researches what consumers want, designs products to meet those wants, prices them competitively, places them conveniently, and promotes them through appealing channels, a social marketer does the same with health behaviors. The foundational principle underlying all social marketing is exchange theory, and this is a concept I really want you to grasp well. Exchange theory states that people will adopt a new behavior only when they perceive that the benefits of the new behavior outweigh the costs of adopting it. Costs are not just financial, they include time, effort, social embarrassment, physical discomfort, and giving up pleasurable behaviors. Your job as a social marketer is to increase the perceived benefits and decrease the perceived costs until the exchange feels worthwhile to your audience. When you think about it this way, you start to see health behavior change through your audience's eyes, and that perspective shift is incredibly powerful. The framework you absolutely must know for the exam is the 4 P's of the social marketing mix, and I want you to feel completely confident with each one. These 4 elements work together to create a comprehensive strategy for behavior change. The first P is product. In social marketing, the product is the desired behavior you want your audience to adopt, along with the benefits that come with it. Product actually has 3 layers, and knowing these layers will help you on the exam. The core product is the primary benefit the audience receives, such as feeling healthier or protecting their family. The actual product is the specific behavior itself, such as getting a flu vaccine or wearing a seatbelt. The augmented product includes any tangible objects or services that support the behavior, such as a free vaccination clinic or a reminder application on a phone. The second P is price. Price refers to everything the audience must give up or endure to adopt the behavior. This includes monetary costs, such as the price of a gym membership, but also non-monetary costs such as time, effort, social stigma, physical discomfort, or psychological resistance. Effective social marketing works to reduce these costs. For example, offering free screenings removes the monetary barrier, while providing childcare at a health workshop removes the time barrier. The third P is place. Place refers to where and when the audience can perform the desired behavior or access supporting products and services. The key principle is to make the desired behavior as convenient as possible. If you want people to get screened for hypertension, put the screening station at the grocery store they already visit rather than at a clinic across town. The fourth P is promotion. Promotion encompasses all the communication strategies you use to inform, persuade, and remind your audience about the product, its benefits, its reduced costs, and its convenient locations. This is where your message tailoring, channel selection, and creative execution come together. Remember, promotion is just one of the 4 Ps. A common mistake is to focus only on promotion while neglecting the other 3 elements. When you keep all 4 Ps working together, you have a powerful and complete strategy for behavior change. Let us bring these concepts together by walking through how social marketing works in real practice, because this is where everything clicks into place. Every successful social marketing campaign begins with formative research. This means conducting focus groups, surveys, interviews, and observational studies with your target audience before you design anything. You need to understand what your audience currently believes about the behavior, what benefits would motivate them to change, what costs or barriers they perceive, where they spend their time, and which communication channels they trust. This formative research phase directly informs your design of all 4 Ps. Based on your research findings, you design the exchange. You frame the product in terms of benefits your audience actually cares about. You reduce the price by addressing the specific costs they identified. You select convenient places that fit into their existing routines, and you create promotional messages using the channels, language, and tone that resonate with them. Here's a step that I want you to remember because it is really important. Before launching a full campaign, you must pre-test your entire marketing mix with members of the target audience. This is not optional. Pre-testing might reveal that your audience interprets your message differently than you intended, or that the location you selected is actually inconvenient for them, or that a cost you thought you had addressed still feels too high. Make revisions based on pre-testing feedback before investing in a full-scale launch. Finally, social marketing is an iterative process. Once your campaign launches, you continuously monitor its performance using process evaluation data and outcome measures. If certain elements are not working, you adjust them. Perhaps you need to add a new distribution site, revise a promotional message, or offer an additional incentive to reduce perceived costs. This cycle of research, design, test, launch, evaluate, and adjust is what distinguishes social marketing from simple health messaging. You are learning a truly strategic approach to behavior change, and that is going to set you apart as a health education professional. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. Option B directly addresses both identified costs in the price element. The 15-minute format reduces the time barrier, the lunch break timing fits the workday constraint, the private wellness room eliminates the embarrassment barrier, and the walking format requires no special equipment or skill. Option A addresses promotion, not price. Option C fails on place because weekends do not address the workday barrier. Option D is also promotion and does not reduce any perceived costs. Summarize the key takeaways.